What does it mean to be a doctor today? A doctor today is seen as a healthcare provider. A doctor today is seen as a businessman selling a service, and that's why we are all covered under the CPA. But actually, the meaning of the word doctor in Latin means a teacher. So that is the core purpose for which society has some people practicing medicine as an art and science, that our role is as a teacher. Incidentally, it has now become the other two also. But all this teaching is relevant because lack of awareness about chronic kidney disease is universal. The literature says that the awareness of CKD status amongst people with CKD was only 6.4%, well under the healthy people 2020 goal of 11.7%. And this is American statistics. And in one nephrology practice of 676 patients, they found that 1/3 reported limited or no understanding of their chronic kidney disease and no awareness regarding their treatment options. This is America. So my job today is to moderate this panel discussion of people who work on the floor, on the ground. Ms. Kuljit Kaur, who works in the dialysis facility at the PGI Chandigarh, Dr. Rachana Jasani, who has been working as a dietitian in nephrology, and Dr. Pallavi, who is a resident in nephrology, to get their perspectives as to what are the barriers to CKD education. Yes, we all agree that CKD education is the need of the hour, but obviously it is not an easy pill to swallow. For as literature shows that there are three kinds of barriers that we are facing. One is a barrier which is specific to the patient. Each individual patient will have a different barrier. Second is the barrier which is there to us as providers of healthcare. And the third is the barrier which the system under which we operate has created. Let me first start with the system barrier. There is no incentive for the time spent on education. You put a central line, you put a double lumen catheter, you could put a permacath, you do a kidney biopsy, you are compensated handsomely. But you spend 45 minutes talking to a patient, going through his emotional distress, going through the family dynamics at that moment, you do not get any enhanced consultation fees. You have limited decision support systems, and there is a lack of any interdisciplinary care as of now in our country. So you're a typical nephrologist in the periphery, away from the teaching hospitals, is all rolled into one. He is the dietitian, he is the social worker, he is the clinical psychologist, he is the coordinator, and he is also the nephrologist. So when you have so much of pressures on the time of an individual, the system is too much tilted against education. In America, they realized this because their progress of CKD was unbridled, and their one out of, I think, $20 of taxpayers' money is spent on healthcare, and they found that it's very expensive to deal with this kind of a system. So now they have recently started compensating the doctor for education, CKD education. A day will not be far when we will also realize that it is cheaper to educate and change the way people live than to put them on dialysis or transplant. The second barrier is a barrier which could be there in our hands to overcome. This is the barrier of time constraints. Yes, all of us are busy. So now is the time to delegate our responsibility of our tasks. Ultimately, but the responsibility will remain with the nephrologist, and divide this task into tasks which we have already done. For dialysis, when I started practice, we would prime the machine, needle the patient, and do everything in dialysis. As time flew, none of the nephrologists today would be able to do that themselves, and therefore they have created this vast army of dialysis technicians. Now, many of us are delegating the job of dietary education to dietitians. But still, there is a poor prioritization of progress of CKD as a treatment goal in nephrology practices. And therefore, we are looking at endpoints always, that transplant is the best modality of renal replacement therapy. But why allow people to perpetually land up on transplant or dialysis? Sometimes I feel that we have a lack of confidence in our ability to teach, to change people's behavior, because there are challenges in communication of the complexities of CKD. Even those people I found whose mother tongue is Marathi, once they become nephrologists, they get tremendous difficulty in communicating these concepts in Marathi to their own people. This is nothing personal, but just an observation that we have challenges in translating some of these Western concepts into our own native language and expressing it. And then when should I give time in the busy OPD to education? And there is ultimately a lack of a tried model. Although from the conference proceedings, I understand that CMC Vellore would be a model worth learning about more. And then the most important barrier is patient-related barriers. It is undoubted that our health literacy is very low in India. Although people may be literate, they may be postgraduates, but you ask them about the body and the parts of the various parts of the body and what each part does, or what does blood sugar mean, that figure mean, what does serum creatinine means. There is a very low baseline health numeracy talent. And because of this, and because of our people's unpreparedness to face a major illness, there is denial of illness as the first defense and a lasting defense through which your education is supposed to pierce and change behavior. And because there is denial of illness and fear of the illness, there is lack of interest in acquiring knowledge in people. So when you want to talk to patients, I have found that many patients say, "Doctor साहब वो सब मत बताइए, वो तो सब आपको मालूम होना चाहिए, हमको ये बताइए, हमारी किडनी तो फेल नहीं होगी." So fear of taking up responsibility and pushing up the responsibility on somebody else is the standard way in which people behave. So to take the story forward, may I invite Ms. Kuljeet Kaur, who works in an dialysis facility at PGI Chandigarh, to share what her experience has been when she tries to speak to patients who come to her dialysis unit. And what is it, and how does she manage the show? What are the common questions that they have? What are the knowledge deficits that they have? What are the skill deficits that she has, patients have? And what is the general attitude of the population that she is serving about education? Over to you, Kuljeet.